Hello, it's Leah. Thank you for being here and listening to my story. This is a multi-part story because it is quite long and I prefer not to have like a 3-hour video. I had a hospitalization for diverticulitis and it was talking about the interactions I had with the doctors. And a lot of that was background leading up to the complete clusterfuck that is my second hospital stay. The story of my second hospitalization begins when I called my partner crying. He was at work. I was in so much pain that I couldn't actually not cry. With like a hugely high pain tolerance, I was like bawling my eyeballs out and saying, something's wrong. We need to go back to the hospital. When I tell you he got in that car as fast as his feet would carry him, that is an understatement. Like he was probably breaking speed laws coming to get me because like he was just like there like that. He was very concerned as well. We went back to the hospital. This time my partner like dropped me at the door and I kind of walked in with my rolly, but I was like stumbling in because I was in so much pain and I was still crying. It was so painful. I got in there. And I must have looked alarming enough that the intake nurse was like nervous because I came in and she was like, can I get your health? Oh, honey, come right in. Like she just was like, don't even sit in the waiting room. Just come right into intake. And she like hit the thing and the door opened and I went right. Like I did not even stop at her desk. Like she came to my little spot where I was sitting with the intake nurse and got my health card from there. Like that was really actually quite heartwarming because it's sort of the opposite of how I'm used to being treated in medical situations. It's like, normally it's like, nah, you're saying it's a 10, so I'm going to assume it's about a 3, you know? Like, but she was like, oh, girl, come in. Like, please just pass go and come right on in and collect $100. They right away knew something was very wrong because it was like 3 weeks later. They asked me about the pain. They said, is the pain as bad? I said, no, it's worse. Like the pain is worse this time. And they said, oh boy, that's not a good sign. Very soon after that, I was brought into the back. None of the people up front are allowed to give you like painkillers more than Tylenol and things like that. But I got into the back where like they actually begin treatment. Like they might put in your IV, they might like take your blood, they might do that kind of stuff. And they did take my blood. They took my temperature. I think I did have a fever. So they immediately put me on painkillers. And then very shortly later, they also put me on intravenous antibiotics again. But they were so busy that they basically gave me the intravenous, like, you know, you have the pole sort of that you can roll around. And they had me hooked up to these antibiotics and I just had to roll back out to the waiting room and plunk down with like, you know, all the people who had just arrived and stuff until they could find literally anywhere to put people. It was bananas. And I sat there for, I think in total, it was about 14 hours before I saw a doctor. But prior to that, you know, they took me in, they had me do another CT scan. At some point, a surgeon came in and he said, okay, so here's what's happened. Your diverticulitis, which is an infection, that's not doing too bad, but you have an abscess. Now, if you don't know what an abscess is, basically bodies are so good. Like they try so hard, but like sometimes impact versus intent is not a bad phrase to use here. They're different things. Basically, sometimes your body will be like, you know what? I have noticed that there is an awful lot of infection around here and we don't want that to spread all over. So we're going to take it and we're going to make like a little pouch and we're going to shove it all in the pouch and quarantine the infection so it doesn't get out of control. All right. We're going to tuck it away. We're going to keep it away from all the important stuff. But the problem is that when there's a lot of infected material, that becomes an abscess. And I had an abscess about the size of a golf ball in my abdomen. It was actually large enough that it had like shunted my uterus over to the right a little bit. It was kind of like touching my ovary and stuff. Like it was a big abscess. That's where the pain was coming from. It gets bigger and bigger and bigger. It's kind of like a balloon. Like the pressure becomes a real situation. They were like, okay, so here's how this is going to work. We're going to put you on the antibiotics because obviously you've got a lot of collected infected material, but like clearly there's still a lot of infection because your white blood cells are very high. So we're going to put you on the antibiotics. And then what we're going to do is we're going to do what we call a drain. And what a drain is, basically what they do is they take a needle that has like a little tiny tube in it and they basically thread the tube through it and they take the needle and they put it through your muscle layer layer, whatever, in your abdomen, wherever that abscess was, they were going through everything till they reached the abscess. Meanwhile, they've got a little ultrasound going so they can see what they're doing. It's actually a really fascinating procedure. And so they kind of puncture the abscess, and then they leave this little tube in that was threaded in the needle, and they attach that to one of those, like, you've probably seen people who like have kidney problems and they have like the tube that goes to like a little bag to collect their pee. It's basically the same thing, except it's not collecting my pee, it's collecting whatever was inside the abscess. So it's mostly really gross looking, like pus and stuff like that. Now, they had sedated me, and they had, I think, used a little bit of like local anesthetic, but they didn't like put me under or anything for it. And I remember lying on the table and they were about to do it. They didn't give me any warning, but when that needle went into that abscess, oh boy, I thought they were going to have to peel me off the ceiling. Like, it was so painful. And it was so sudden that I actually jumped, and they're like, hey, don't move. And I was like, I mean, I'm sorry. I'm really trying, but you startled me also. And it really hurts. So like, maybe tell me before you're going to go in so I can brace myself, you know? But they did get the little tube into the abscess. It's almost immediately that it feels better. The pressure was the problem. So as soon as that fluid had somewhere to go, it was so much less painful. They say, okay, so we're going to put the drain in. It'll help drain some of the infected materials. They call it a collection often, as though it's like, you know, very valuable baseball cards or something you want. And you're like, I don't want this thing. The abscess or the collection would theoretically shrink. And then if more infected material came out, it would continue to drain out. And then you sort of get to a point where if in a day less than X amount comes out of your abscess, you're pretty much ready to have the drain removed. That's sort of how that proceeded. For my entire hospital stay and after, I did have my abscess drain. It was not that bad. It was kind of gross, but it wasn't that bad. They found a room for me. They put me in the room. I was back on fluids because, of course, while they're beginning the antibiotics for the actual diverticulitis, again, they want to rest the colon, so nothing by mouth. They call it NPO. I mentioned it in a previous video. I'm a big water drinker. I couldn't have any water. The best I could do was, if I was really desperate, they would give me like a little cup of ice chips that I could suck on. Oh, it was terrible because your lips get really dry. I was like going through chapstick wholesale. After about 6 to 8 hours, I'm in the room. I'm on the fluids. I'm feeling pretty good as long as they're controlling the pain, because the pain's pretty bad. I'm on painkillers and stuff. But at a certain point, like I think it was, as I say, about 8 hours later, I'm like, man, am I ever hungry? That is so weird. I don't remember being this hungry before. Because like we did this process once before and it was like totally fine. Why am I so hungry? That's weird, you know? When a nurse came in, I had asked, you know, hey, do you know what's in this bag? They had said, I can't remember who it was. They had said, oh, it's like so you don't get dehydrated. I was like, yeah, but like what exactly is in it? Like, this is the one with like, it has like the hydration, the electrolytes, and the dextrose, right? Because I'm NPO, I can't have any kind of nutrition. So like, where is that piece? Like, is that included? And she's like, oh no, this is saline and electrolytes. And I was like, oh, well, I think they've made a mistake because I'm also not allowed to like have anything to eat. Like, you can't heal without energy, right? Like, it takes energy to heal. And I'm like, that doesn't make any sense. And so I said, oh, okay, I think there's been a mistake though, because last time I was in, I had the same thing, NPO, I couldn't have anything to eat or drink, but they had said to me, there's dextrose in it, so that's where you're getting your nutrition from. And it was great because like, I didn't feel hungry or anything. And they gave you like enough that you're comfortable. They don't overdo it or anything, but it's like enough you're comfortable. It's enough that you have the energy to kind of like work on healing and like all that stuff. Then I still don't have to like always feel like, oh, I want to eat something, because like, yes, my mouth is dry, but at least I'm not always like, oh, my tummy's so empty and like hungry and growling and whatever. And so the nurse said, oh, okay, well, I checked the order and it did say this was the correct IV fluid. So I wonder why that is. I said, well, could you double check though with the doctor? Because like, this is not how it was last time. Like, I don't know what's changed. I understand if like I was waiting for some kind of procedure or something, but we already did, like we inserted the drain and everything, like that's already done. Because when you're having a surgery, you can't have anything at all. And like, there's like not a lot of scenarios, but some scenarios where even like having dextrose like intravenously could interfere. So I'm like, okay, like I might get that if like I'm waiting for a surgery, but we've already done the procedure. There's no reason I can think of why that would be the case, you know? I asked the nurse to confirm with the doctor. Come to find out, it's the same doctor as the last time. So my My favorite resident is back again. She comes in one morning, says, how's the pain, this and that and the other. I said, well, the pain's not too bad because they're giving me pain medication. But I said, I am hungrier than a bear. Are you not able to give me anything in the intravenous? Like the IV fluid last time had like dextrose or something, enough to like keep me not like constantly feeling like I'm hungry and like I had more energy. Like right now I'm just like, I sleep all day because I have no energy at all. She's like, oh, well, we're trying to rest your digestive system. And I said, yeah, but it's going in my veins. And she's like, yeah, but just to be safe, because you can have some real trouble with like when you have a procedure like this, you can have like nausea and stuff. And we're really worried about, having you eating anything. And I was like, even if it's in my veins? Oh, yes, definitely. And so I was really confused because I had never heard that like what goes in your veins is going to cause you like an upset stomach or something. And I was like really confused about that. I ended up being in the hospital again about like between 5 and 7 days. By about day 3, when the doctors come in the morning doing their rounds and everything, right? But there's 1.5 million patients. So what you often have is like this sort of congregation of doctors. So in this case, it wasn't sort of like the Grey's Anatomy situation where there's 8 doctors on their clipboard or anything, but it was like an older gentleman who was kind of supervising the resident, I guess. And then the resident who I had last time, who I made really uncomfortable by crying at her. They had kind of been doing the rounds. And oftentimes because there's so many patients and you can't remember everything, they'll sort of stop at the end of the hall or whatever. And they'll say, okay, so the patient in such and such room, this is the situation. And then the patient in this and whatever. And then they'll sort of go in after they've sort of like explained, I guess, a little bit of background so that they've refreshed the memory and everything. And so one morning, this is I think the 3rd day I was there, I had heard that they were doing their rounds because they had kind of been going around and they had stopped just outside my room and they were briefing each other on like, okay, here's the situation. Her name's Leah. This is her condition, whatever. And I could hear what they were saying. Just like the face on the resident when I called her out for being ridiculous about thinking I was so fat that my ankle just collapsed under my sheer weight. That was like the highlight of my first visit. The highlight of this visit was this moment. So it's like an elderly gentleman who looks a little bit like a gray-haired Mario from like Mario Brothers. He has like a mustache and he's like this little short Italian man, really charming. He's standing there with this very young resident who, as I say, like I was familiar with her from last time. And he says, okay, so this is Leah. She reports that they're controlling the pain all right. She, oh, is this correct? It looks here like she's, still NPO. And so the resident says, oh, yes. And he says, oh, why is that? And she says, oh, she reports pain. And he says, oh, like stomach pain. And she's like, pain in the site. And he's like, the site, like the abscess drain? And she's like, yeah. And he's like, right, but that's in her large intestine. That's in her colon. And she's like, yeah. And he's like, so she hasn't got any nausea or anything? And she's like, no. And he's like, so then why can't she eat? And the resident's like, I thought because, she was having pain, that she wouldn't tolerate food. And he was like, oh, no. I mean, I don't mean to, guess your judgment or anything, but that's not normally how we do things. If the pain isn't in her stomach, there's no reason she can't eat. She's not waiting for a surgery or anything. And so she was like, oh, okay, my mistake. She was very like trying to be very humble and apologetic and everything. And I'm just sitting there thinking, girl, you just got called out. You just got called out in the nicest way possible, but you messed up. And this was like a moment where I was just like, man, this girl is petty. Like she is retaliating because I didn't want her to cut me open last time. Anyway, so they come in and I'm just like giddy, but I'm trying to like stuff it down because I don't want to like laugh in her face because that's still kind of mean, even though she kind of deserves it. But I was like, okay, I'll be very serious and very attentive. And when she leaves, I'll have a giggle to myself, Anyway, so he says, how are you doing, etc. And I said, well, they're controlling the pain okay, but it is still, I'm still on the heavier painkillers, like I'm not on like Tylenol or whatever. In a few days, maybe I won't need them anymore. But for now, like I really do need them. I'm, every time I'm allowed them, I'm taking them because the pain is coming back. But I said, it's not as bad pain as before the drain. So that has really helped, like it's really alleviated the pressure and it's working well. And he's like, oh, that's great. Great to hear, whatever. Keep on trucking. He was just very enthusiastic and very encouraging. And I actually quite liked the Italian guy. He was fun. So they left. And when I cannot tell you how excited I was for my partner to get there so I can tell him how he basically set her straight about like just basically starving me out of retaliation. And I'm just like, why do you have to be that way, you know? So I went about like, in total, I think I went about a day and a half to 2 days without anything in my IV drip until he had that conversation with her. And then after that conversation, I didn't get fluids. I didn't get like clear fluids, like eating Jello and apple juice. I got like a turkey sandwich. Like I got like a full meal. And so he was all like, no, let the girl eat. It's fine, you know? I would say that like in the whole process of dealing with doctors with this particular condition, I did notice that the younger the doctor was, actually, the more weight bias there was, where like you've got these really young like residents and like the first surgeon, she was like, I would eat my hat if she was more than 35. And these are people who are just like my contemporaries or maybe younger. Like I think certainly the resident could have been younger than me, but they're like so adamant about like this girl cannot be fat. Whereas this Italian guy walks in, he's like, yeah, no, let the girl eat. You know, he's just like, he's fine. And he probably was in like his 60s. And so like, I do think there's something generationally as well, because my family doctor who really doubted my symptoms and stuff. And as I say, we have a better relationship now, but at first she really doubted that I was telling the truth about symptoms and stuff. And she was always saying like, oh, you have like lung infection, weight loss will fix that. You know, like she was just like kind of silly in that way, but she's also very young. And I think like she might be about my age, but she is a younger doctor. And I have noticed a difference where, and that to me was quite counterintuitive, which I think also shows my age bias. Like I really thought like older people are old fashioned and they like are not as open-minded or whatever, I think is something that I had in myself as well, because that surprised me. And I don't know that it should have surprised me. And I'm trying to like own that also as a person who doesn't want to be going around like an asshole and being like, you're older, therefore you're closed-minded. That was kind of an interesting thing that I learned about myself as well. I have absolutely during this process found that he's been one of the most like, I don't care if you're fat, of like all the doctors that I dealt with. So at that point, and this is something that I think is really sensitive, I'd like in the next part of this story related to my second hospital visit, I think I really want to talk about the effects that it had on me not having anything at all in my IV drip for a couple of days, how that affected my body and like the implications of that for people who are like trying desperately to make me thinner and how backwards it kind of went. I can't wait actually to share that with you because I think it's like actually one of the most fascinating parts of this whole experience because biology is wild. Let's just say that. So anyway, thank you for joining me this time. I look forward to seeing you in the next one. Bye for now.